have heard it as K2 or Spice on the streets. There's other products out there like Black Mamba, Mr. Nice Guy. Yeah, they get creative. So I wanted to talk about that today because there was a patient that I didn't personally follow, but I overheard her case. She was a previously healthy 37-year-old that came in, or she actually went to an outside facility, and she had complaints of slurred speech, altered mental status, aphasia, that progressed to seizures that were unresolved with any anti-epileptic drug. She was then transferred here, continued to have seizures for up to 2 to 3 weeks with no relief of any kind of anti-epileptic medication. Therefore, they ruled out any kind of other infectious process. The MRI was negative, brain biopsy had no signs of inflammation or malignancy, and finally a family member had mentioned that she had used K2 or Spice. But like I'll talk about in a little bit, it's kind of hard to kind of diagnose somebody with this since it's not very detectable on regular drug screens. So what is K2 Spice? It is a herbal blend that's laced with chemicals that are sold as incense in stores, but if smoked will have produced similar effects as marijuana. These chemicals are considered synthetic cannabinoids because they differ significantly from marijuana or the tetrahydrocannabinol structure by their structure, lipophilicity, and their activity at receptors. So I also added both structures on the handout of both marijuana and then just one type of synthetic cannabinoid. They were developed by John W. Hoffman. So some of them are considered JWH with a number afterwards, with the original intent to try to just investigate other areas that we could use cannabis for medicinal purposes. However, now it is being abused. The mechanism of action of these, they have higher affinity at the cannabinoid receptors, CB1 and CB2, than THC does. They are actually full agonists at these receptors, whereas THC is partial agonist. And specifically, CB1 is found in the hippocampus, the basal ganglia, and the mesolimbic system of your brain. So that's where it's causing the psychomotor activity or the adverse events that we're seeing mainly with these patients of psychosis and anxiety. The CB2 receptors, I just found that they were located in peripheral tissues, and they may help with immune regulation, but I also found that the synthetic cannabinoids don't bind as highly to CB2 than CB1. Also with blood concentrations, they can be found in blood within 5 minutes of ingestion, which usually patients or people are smoking through inhalation with this medication or this cannabinoid, but they can be detectable for up to 48 hours after ingestion. So the main adverse events that we're seeing with this is anxiety, paranoia, hallucinations, acute psychosis, confusion, up to tachycardia, hypertension, and even vomiting or abdominal pain. The paranoia and anxiety are one of the major, or acute psychosis, one of the major adverse events that are reported in poison centers. And I was talking to Stephanie that works in the ER. She said they saw up to almost 300 cases of this in the ER in the last year. So this can be a major issue that can lead to suicide ideation with some of these patients, especially if they have a mental illness in the past. Other major adverse events also reported were rhabdomyolysis, acute kidney injury, acidosis, myocardial infarction, seizure activity, and sudden death, just like we kind of saw with the patient case. And then withdrawal symptoms have been seen that include anxiety, nervousness, headaches, depression, and irritability. So we kind of get you an idea that this can be abusable if they're having these withdrawal symptoms as well. The evidence out there regarding these agents is purely based on case reports. So I kind of pulled some treatment suggestions from what other physicians have done with these toxicities. So they have used benzodiazepines or haloperidol for your acute psychotic episodes, mainly for sedation, just to help get the cannabinoids out of the system. They've also used antiemetics for nausea, vomiting, hypertension, tachycardia. They could use a non-selective beta blocker. They mentioned alpha-1 adrenergic receptor blockers. That's not as commonly used for hypertension and tachycardia, but beta blockers could be a good option. And rhabdomyolysis, you just want to make sure you're assessing the fluid resuscitation and then their electrolytes. And then seizures, you can use benzodiazepines as an anti-epileptic as well. A few case reports that I saw, they did not put anybody back on maintenance anti-epileptic after they left the ER, just because after they got the cannabinoids out of their system, they did not have a seizure again. So mainly it's just supportive care, what the patient comes in with. And like I said, we can't really detect it on their regular drug screen since it does not have the THC component that is measured by our drug screen. There are a few drug screens out there that will detect specific synthetic cannabinoids. I included this ELISA, or Neogen ELISA drug kit. However, it was only caught about 18 of the 73 compounds that are even out there that they even compiled. They said that they had a 99% specificity and a 75% sensitivity. But again, it's just kind of, there's so many products that are being produced on a daily basis that who knows what your patient's actually going to be on when they come in. So it's kind of difficult to really narrow it down. And as far as regulation, on the package it says not for human consumption, but people abuse that. And the DA has put into motion putting some of these substances in Schedule 1 of the Controlled Substance Act, and there's a Synthetic Drug Abuse Prevention Act out there that is trying to put some of these substances into a Schedule 1 drug category. However, they were kind of the original ones, the JWH compounds, so the more frequent ones and the newer compounds that are coming out are not Schedule 1 just yet. So, yeah, that's all I have for this subject. Is there any questions? Yes?
So I know the JWHs are now, you can't get those anymore.
Right.
So the new synthetic ones, I assume they have similar affinity to C1s?
Yeah, if not even more.
Okay.
I think that's what they're that's what they're seeing, is that they're either even more affinity to that CD1 receptor or the same. I think all they're doing is tweaking the original structure just slightly, and it's still just having that full agonist CD1 receptor activity.
But if those are the ones, you can still get those in instant shops and stuff, right?
Yes, I actually Googled how people can get it, and you can get it off the internet. It can come in as a white powder as well, and they can melt it down into the tobacco using acetone, and it just sounds dangerous. But if I can Google it, I'm sure anybody else can.
We did this with UFC.
Make sure you don't drink it. Yes.
So how was the patient handled?
She passed away, unfortunately. The seizures never actually got resolved. She was on high doses of pentobarbital, carbitol, phenobarbital, Keppra, Depakote, everything.
I'll call it almost like experimental, because we got to the point where it was just, we were trying anything. Literally anything, and like normal monitoring of drug levels, we went shot way higher than.
Did the cannabinoid
When we were having that endemic here in the earlier part of the summer, the mortality rate of this was like 88%.
And that was like
crazy.
bad batch. That's what Stephanie was saying. So that's what's scary is when I tried Googling how to make it, because I was like, how are other people making it?
On UMC,
On UMC, yes. So I don't really know exactly who's actually producing these compounds. I don't know. It's just crazy. Really? Well, I know in a lot of European countries they have it completely banned to have any kind of synthetic cannabinoid, whatsoever. So they tried. And there are a lot of studies in Germany too where the German investigators actually try it to see what happens. That was interesting. On UMC.
So, do you know what the time frame was like? I mean, is this a few hours?
How long it lasts?
Yeah, well, that also this patient that passed away. Was it a few hours later? Was it a week?
It was the patient that. Yeah.
Is it something where if the duration of the drug, the duration of action, if you exceed that, they come down and they're okay, or is it can it be indefinite? I know it may be different for all the different compounds.
I think it could be different. I know the case reports, they actually reported the seizures went away after about 48 hours after it's supposed to be out of the system. I think it depends on how often you were using it. Are you a frequent abuser? That could have been an issue too, of how long those receptors were being stimulated, and then once you stop, I think that could be a factor too.
So it could be their first time smoking it and they could die instantly, or they could get a renal failure rather than die a week later, or they could seize like this patient for over a month, 3.5 weeks, 4 weeks, and then eventually like there's nothing else often until you have to drop in. But it's really patient specific. There's no way to know how they're going to respond to it or what exactly it is in here. So it's like so dangerous.
Like some of the patients come in the ER and they're mad at it crazy, but we let them chill out in bed and give them fluid, they leave and they're fine. And then other ones come in.
Try to pull the bed over.
Yeah. Some of them get real bad, and they're fighting everybody and they're
So
messed.
don't do drugs, kids. Not even illegal.
I think part of it too is what else it's laced with.
Right.
And that's something that a lot of people miss. Like, it's not just these compounds. So what it is, like, they buy the chemicals in bulk online and it's sprayed on organic matter. So whatever that organic matter happened to be, you know. And another thing that I wanted to bring up, just from talking to my recovery patients, there's a new thing going around. It's called medical marijuana, where they're spraying spice on cannabis, and it's medical marijuana, and so they don't realize that they're getting spice with it. So that should be fun.